Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, as usual, today we will discuss about a very small topic in Ayurveda, which is clinically quite important. So that is about fever. Now, fever is the most common clinical symptom, we know that, and everybody will have a curiosity regarding the explanation of fever in Ayurveda. Now we know that Ayurveda explains fever with greater details in the form of jwara chikitsa, etc. But the question comes, when Ayurveda talk about jwara, it says that for the first 7 days there is no need of any treatment, and usually they will call it as Nava jwara, okay, Navina jwara or Nava jwara. So in the Nava jwara chikitsa, actually they have not mentioned any of the treatment. Langanam, Swedanam, Kalo, Yavago, Tiktako, Rasaha. So this is the only treatment which is explained, and no any drug treatment is specially explained. Now, why Ayurveda explains this concept of Navajwara and why there should not be any medicines given for the first 7 days? Ayurveda has got its own explanation because of Agnimandya and all those things. So if you give the medicine again, so it will again cause the ajirna, and because of this, we should not give any medication for the first 7 days. Now, when we go further here, in the routine clinical practice, what we get 3 or 4 types of fevers. Number one is sometimes fever is made because of viral fever, bacterial fever, or parasitic fever, or sometimes immunological fever. Fever because of immunological problems. Now, each fever has got its own pattern. Now, a viral fever usually starts very acutely and it raises. In the first 1 or 2, the fever is very, very acute and as well as severe. And from the 3rd and 4th day onwards, the intensity of the fever subsides. By the end of 6 or 7 days, there is no fever. This is usually a pattern which is followed in case of viral fever. And interfebrile period is normal. And as well as it responds very well, very good for the responds very nicely for any of the antipyretic drugs. Okay, and it has got multiple symptoms. Most of the time it has got multiple symptoms and generalized involvement will be there. So this is a pattern of viral fever. Another is bacterial fever. Bacterial fever, to begin, it starts very slowly. Slowly the fever rise up. By the 3rd, end of 4th, 5th or 6th day, the fever will be in peak. And then we require the specific treatment for its treatment. And interfebrile period is not so happy here. Interfebrile period is sick looking, and child is sick looking in the interfebrile period, and response to the antipyretic drug is not up to the mark. It is okay, 50%. Fever completely not reduced. Interfebrile period is sick, and as well as fever. In the first 1 or 2 days there is mild fever, but gradually fever picks up and it will be very peak from 6th, 4th, 5th, 6th day, etc. More than that, a bacterial infection most of the time will have a localized infection or localized involvement, not the generalized involvement, just like in the viral fevers. Now, immunological fever is another one. It is because of the body immunology. The fever is coming, maybe Kawasaki disease or SLI, then IG nephropathies, then there's rheumatic fevers. So these are all comes under the category of immunological fever. So they have got long interfebrile period. Okay, long interfebrile period, and rhythm is maintained about 10 to 12 hours of gap. Okay, child is not so much sick looking and not even so much of happy also. And the fever on the first day, 2nd day, 3rd day, 4th day, it is consistently same fever. Okay, so there is no increase, there is no decrease. Almost all the same degree of fever will be maintained in case of immunological fever. Whereas in case of parasitic fever like malaria, etc., we know that the pattern, it may comes in episodes or it's coming in intermittently. It is coming in a gap of 24 hours, 48 hours, etc. And there is no rhythm maintained, especially the rhythm is very erratic there. So these are the different types of the fever. Now, when Ayurveda say it's Navajwara, the fever which is coming should be considered as Navajwara for the first 7 days, because we should not over-treat the fever. So suppose if you over-treat the fever, what happens is, so you are not in a position to identify which type of fever it is, whether it is a viral fever, whether it is a bacterial fever, whether it is a immunological fever, or whether it is a parasitic fever. So this diagnosis is not possible if you overtreat the fever. If you overtreat the fever, suppose if you're not giving any medicine and waiting for 3 to 4 days, and by the end of the fourth day, if the fever comes down, then it is almost all diagnosis is clear that this is a viral fever. Okay, and if you're not treating the fever at all by any of the medicines, and gradually fever is increasing and getting localized to one particular area, maybe in the abdomen, maybe in the CNS, maybe in the joints, maybe in the liver, anyway, so then it clearly indicates this is a bacterial fever. And if the fever is of similar pattern, there is no progression, there is no degradation, and that suggests it's immunological fever and interfebrile period if it is long. Now, the concept of Ayurveda is very clear. Don't overtreat the fever. First, identify. Suppose if I overtreat the fever on the first day itself, maybe giving some of the higher dose of antibiotics and all those things, so then the diagnosis will going to be mixed, and the future management will be very difficult. So therefore, especially what Ayurveda says, Langanam Swedanam Kalo Yavago Tikta Korasa. Langana means give the mild food. That means light food. Okay, because already Agni is hampered. A patient of fever definitely will have got loss of appetite, enterocracy, etc. And don't give the solid food more. Solid food should be less. Langanam. Swedanam. Take all the measures so that Swedana can happen, because Swedan to Pitta Raktayo. Okay, so there is involvement of the Agni, there is involvement of the Pitta, and as a result the Sweda has to be done. Svedana helps for the vasodilatation, and that is one of the way of excretion of the temperature. Okay, that means driving away the temperature. Temperature will be there in the blood, and that temperature has to be gone out. One of the way of temperature going out is sweating. So induce sweating by different methods so that the temperature will be maintained, or the extra temperature will be lost. Okay, Langanam Swedanam Kalo. Give the time factor, wait for some time. The time itself tells which type of fever it is. Okay, whether it's a viral fever, if it is a viral fever, by the fourth day it comes down. If it is bacterial fever, by the fourth day it is going on increasing. Okay, so if it is immunological, yes, it will be continuous. So like that, Kala itself gives the treatment many times. The self-limiting disorders like viral fevers, they themselves comes down by third or fourth day. Langanam Swedanam Kalo Yavago Tikta Korasaha. Now what is important is, whatever may be the extent of the fever, you give some such methods which induces vasodilatation and maintain the nutrition. Yavago. So the light substances or fluid substances in the liquid form, so it has to be continuously given to the child or baby during the course of the fever, because nutrition has to be maintained. Okay, because there is a water loss by sweating and all different methods. Even by the patient is breathing more, a fever patient will be breathing more, so through the respiration also there is fluid loss, through the sweating also there will be fluid loss. So you and electrolyte imbalance will be there, so you have to maintain the nutrition. To one of the method of maintaining nutrition is giving a light, easily digestible food like Yavago. So Yavago should be given. Then Tikta Korasaha. You can give certain drugs which are having Tikta Rasa, because Tikta Rasa is considered to be Jarogni again. So it comes down it controls the fever. Okay, temperature it will be controlled. So therefore the beautifully says Nava jwara chikitsa. So this has to be followed in each and every case of jwara chikitsa. Okay, and if by the end of 7th day, if the fever is not coming down, it is gradually increasing, so then it will be considered under the Jirna jwara or Sannipata jwara. Okay, and by that time definitely it suggests that this is not a viral fever, this is a bacterial fever, and you can start the gunshot treatment for the bacterial fever. If you start in the beginning, then it creates total confusion. A viral fever is there and you have started with the antibiotics, it totally changes the picture of the fever, and at the end, after so many investigations etc., we are not able to diagnose which type of fever it is. Now here, if you are not interfering for the first few days, 7 days, one thing is very clear, this is not viral fever. Now definitely either it is immunological or bacterial or parasitic. Then go on diagnosing one by one. And if it is viral, definitely it is a self-limiting, and 3 or 4 days it will come down. So this is the concept of Nava jwara chikitsa, which is mentioned in Ayurveda and which has to be followed in each and every case. Okay, so therefore The Navajwara Chikisa is a very, very scientific aspect. Nowadays, although we overtreat the fever many times, maximum times, the treatment is unnecessary because without doing any treatment, simply coming on the parents' pressure, we are giving so many drugs that is not required. As a physician, as a pediatrician, you should have that confidence. Yes, I know what is happening and what I should do. So in a viral fever, many of the times we are giving so many unwanted drugs that itself creates a lot of problems. Okay, so for the bacterial fever, localization is very important. Sometime many times the fever comes and fever is not localized. There is no symptom, only fever is coming. Okay, so wait for that fever. One or the other day, that fever will going to localize. For the first 3 days, there is only fever. There is no cough, cold, nothing is there. Only fever is coming. On the fourth day, the child start with a burning micturition. Now it suggests that it is a bacterial infection and localized at the kidney. Sometimes only fever for the first 3 days. On the fourth day, the patient start with a pain in the throat. Now it is tonsillitis, bacterial tonsillitis. So like this, the diagnosis can be made if you have got some time there. So yavago kala should be there. So you would give the kala itself decide which type of fever it is. So this is all about the Navajwara Chikitsa. Thank you very much. We will meet again in another class.